Hi, everybody. If you're joining us, Governor Snyder is here, and he's answering questions from residents of Flint about the Flint water crisis. We've got some experts on the phone as well to help answer your questions today. Governor is going to take as many questions as he can. All you got to do to ask the governor a question is press 0 on your phone. You press 0, and you'll have a chance to ask the governor a question. I'm going to let him give some opening remarks, and as you're listening, if you want to press 0 to ask a question, please go ahead. So with that, I'm going to hand it over to Governor Snyder to give some opening remarks, and then we'll dive right into questions.
Well, thank you for taking the time to be on this call. We've done these over the last couple of weeks, and we try to vary the time and days to make sure we can get to more people that are Flint residents, because it's especially important to talk to you. You're the people most affected by this terrible crisis, and we want to do whatever we can to improve the situation as quickly as possible, and we're clearly focused in on that. So in the short term, the question is, how can we make sure that you're getting service with water filters, bottled water, getting your water tested, and moving forward with those activities. In the next phase, what we're hoping to do is get the pipes recoated, and only based on scientific evidence, including participation from good people such as Dr. Edwards, would we move forward with saying that the water coming out of the tap is safe again. We're going to begin that testing in the next few days, and that will be over several 2-week periods that we'll be doing that work. In addition, we're starting the inventory to learn where all the lead pipes are within the city of Flint. That has been challenging, but over the next month, we'll be having a project to go to map the infrastructure for where the lead lines are and where they're not. And that will allow us to then have a good position to say what is the priority for replacing pipes. So this is a series of different activities. In addition to that, I went and presented the budget to the legislature this week, calling for many more resources, not only for water and water infrastructure, but for things like nutrition, health care, particularly for the children and the youngest children, to say how can we provide services to do what we can to deal with the fact they've been exposed to lead and mitigate those effects, reduce those effects in some fashion. And I'm committed to working on that for the next several years to do what we need to do right by these children and to minimize the impact of what they've been exposed to. So we're going to continue working hard, working on the ground. It was great. I was in Flint this morning at the food bank, watching volunteers pack up food, actually doing some packing myself to say how can we get more nutritional meals out to people in Flint, and particularly focus in on the kind of products, the vegetables and different things we would hope the children can eat as much as possible to help address this issue. So with that, I'm looking forward to your questions.
Thanks again. Governor Snyder's on the phone, and he is answering questions. To ask a question, press 0 on your phone. To ask a question, you press 0 on your phone, and we've got a couple members of our staff from the department level who can help answer questions as well today. So I think we got a first question in here. Tisha, you have a question for the governor. Tisha, go ahead with your question.
Yes. I'd like to know why my mother's not receiving water and it's supposed to be delivered to every household in the city of Flint. She's 91 years old, and there's nowhere in the world that I should have to go out and purchase water for her.
Yeah, well, Tisha, if you can make sure we get her address, we have your number, we'll follow up with you, because, again, we actually have people ready and prepared to help deliver water to people that don't have that. So if there's an issue with that, we want to follow up with you. And 91 years old, you're right. You shouldn't have to be out going to get water. We should be able to find ways to bring it to you. So I think we have your phone number, and we'll follow up with you separately to get her address and information to see how we can take care of that.
Yeah, that's a great point. So information I'd like to give out is there's a phone number you can call. It's the United Way runs a 211 line, and so you dial 211 if you do need water delivered, if you can't get out to one of the fire stations or you need help. So call that 211 number that the United Way runs, and if you need somebody to get water to you. I am next going to go to Darlene with a question for the governor. Go ahead, Darlene.
Yes. Governor, everyone is mentioning about the refund on the water bill, and I have a question about the water service charge and the sewer service charge. Those are the largest amounts. For example, the service charge on my bill for the sewer is $34. The sewer is the water service charge is $22, and my water bill is only $6.19, and the sewer non-metered is $4.31. But no one is mentioning those service charges. So I wondered when they would be returned.
Yeah, Darlene, what we want to do is, and this is why I've asked support from the legislature, is to do a credit for the water portion of your bill. The sewer portion of your bill, people have still been using, toilets, the sewer system, so that part of the bill still needs to be paid. With respect to the water portion of the bill, we did some work to calculate about 60% of the water bill. That would include that service charge, both the service charge and the usage fee. So what we're working to do is to say 60% of the total water portion is the part we're working to get a credit for, because that's the part of the water that you should normally be able to use coming out of the faucet for drinking, for cooking, for those kind of uses that you're not able to use. And so we're looking to get a credit for 60% of the total water portion of the bill. The remaining balance of the water usage is for, again, flushing toilets, other uses, washing dishes, washing clothes, things like that, plus the sewer charge is water that's separate and apart you'd be using that could have issues with lead or other contaminants.
Thanks. Again, if you just joined, Governor Snyder is answering questions. You press 0 on your phone to ask a question. Next question is going to be Edna. You have a question for the governor. Go ahead, Edna.
Edna, I have already asked you about the water, when system water was going to be on. It's going to be so we can drink it, how long it's going to be.
In terms of deciding that, we're not doing that based on simply a date, because that wouldn't be right. What we want to do is make sure it's being tested, and we're bringing in third-party experts so you can have confidence in the results. So we're talking to people like Professor Edwards and such about what tests we should be doing to make that determination that the water will be safe again, and the pipes are being recoated. So that testing process is actually starting in the next few days, where we've got over 400 sites that will be the key sites that we'll be using spread throughout the city, and in particular areas that appeared to have higher risk or higher problems with lead. So that testing will begin, and we're going to do basically 4 two-week cycles of looking at results, and then based on that, we'll make a determination of whether we're at a point that the water is safe or not.
Thanks, Edna. Next question is going to be Barbara. Barbara, you have a question for the governor?
Yes, I do have a question I wanted to ask. I would like to know, I appreciate the water that they have been giving us and the filters, the filter out some of the lead. I'd like to know, why aren't you going to have the pipes just replaced, dug up and replaced? Because you put something you switched over to the Flint water and it didn't work. Now you're going to put some coating on the pipes, and then if that don't work, that's number 2. And then why don't you just go ahead and do the pipes, replace the pipes?
A good question, Barbara, and this is where we're following what the experts are telling us is the best way to do this. This is actually the advice we've gotten from Professor Edwards from Virginia Tech, who discovered this issue. And he told us the best process to go through is the pipes should be able to be recoated, and that process has been underway since December, but we don't want people to assume it's okay until we've done extensive testing. So the first step is the water should be safe to drink based on the recoating and extensive tests. The second step we need to do is actually find out where the lead pipes are. There are about 55,000 pipes, service lines in the system. 5,000 we know are lead, 25,000 we know are something other than lead, 25,000 we don't know. and that's going to take about a month to map out where those pipes are. And that plan should be starting in the next few days to start the clock on getting all that work done. Based on that, then, we can prioritize what are the pipes that are most urgent for replacement. Because, again, pipe replacement will be part of this over time. It's a question of how do you prioritize which pipes come out first. And that's what this mapping will do, is allow us to decide that so we can get started with that process. So in the intermediate term, again, we want it so you can drink water out of the tap because it's been tested to be safe and recoated. Longer term, there is a process to say how we can look to replace pipes within the city of Flint and hopefully throughout the state of Michigan. Lead pipes are a problem in many communities in our state.
Thanks for the question. Again, Governor Snyder is answering some questions this afternoon. Press 0 on your phone to ask a question. We are going to go to our next question now. Is Eric? You have a question for the governor. Eric, go ahead.
Yes. I'm wondering are we getting whole house filters installed? I understand it's a lot safer.
Whole house filters, actually we have Bryce Feiner on the phone from the Department of Environmental Quality. And Bryce, I think you've addressed this in the past. Would you like to share some thoughts on whole house filters versus the filters on the faucet?
Sure. Thanks, Governor. So one of the concerns is the tap itself. So some taps we've discovered right at the fixture itself are emitting lead or other metals of concern. And so if you had a whole house filter, that would be upstream of the tap and it still wouldn't resolve the drinking water problem. Plus, if you put a point of entry treatment device, filter or otherwise, it's going to be consumed in terms of its capacity much faster than is necessary just to protect the drinking water. So those are a couple of reasons why we don't think that's the way to go for every household.
Thank you, Bryce. Again, if you just joined, press 0 to ask a question. We're going to go right ahead to our next question. Nina. Nina, you have a question for Governor Snyder?
Hello, Governor. This is Nina Lewis. I'm calling. My question has to do with your relationship with the mayor. I'm wondering if you are spending time with her and working through and with her, or if you're working through and with other agencies. The community has a great deal of faith in her because it was she who has really brought this problem to the focus. So that's my first question. My second question is why are they just giving out 1 and 2 cases at a time for people, and that water only lasts a few days or depending on the size of the family, and then we have to go back and get water? Is there some way that we can get a 2-week supply or a month supply at a time? Those are my 2 questions.
No, thanks for your questions. I am working closely with the mayor, and I think we have a good working relationship. It's important that we work together on solving these problems. In fact, I created a group called the Flint Water Interagency Coordinating Council that has people from the city on it, people from the state, the county. We've invited federal officials on it. We've invited outside experts, including Professor Edwards and Dr. Mona, to all participate so we can have a dialogue working through these issues, because we want to work together to get these problems addressed as quickly as possible. With respect to your water question, part of it is to make sure that we can satisfy the bottled water needs of everyone. And so that's why we have the distribution points, so they can hand out 1 or 2 cases, and we can make sure we're taking care of as many people as possible. To the degree you don't have a filter, I would encourage you to look at getting a filter to go along with your bottled water, because the filters are effective to take out lead. And again, if we'd encourage you to get a home water test. The only consequence we found is at very, very high lead levels, the filters may have an issue, but most people, we have very few households that are in that category. So other steps you may want to do is get a water test done and potentially get a filter.
Thanks. Captain Kalinsky, you might want to address the question about how much supplies you can pick up at the fire stations.
Yes, sir. Nina, the one the one case of water is really just a guideline, as the governor said, to ensure that we get enough water to as many residents as possible. But if somebody has a larger family or young children or special circumstances, go ahead and just let those personnel at the points of distribution know that that you have a special case and you would like another case of water, and we will ensure that we get people the water that they need. So the one case is really our guideline, but just have a discussion with those personnel at the points of distribution, and they'll assist you in whatever way you need.
Thank you, Captain. Again, press 0 on your phone to ask Governor Snyder a question. Our next question is going to be Brenda. Please go ahead with your question, Brenda.
Yes, I was just wondering, for the last 2 summers, 14 and 15, I've been using Flint water to water my garden with. And I was just wondering exactly what effect are any on the consumption of the vegetables that we are eating with the water.
Yeah, that might be best Nick or Bryce. Do you want to address that one?
This is Nick. I would have to go back and check with the Department of Agriculture, so I think we're going to have to get your name and reach back out to you. That is a very good question.
Yep, this is Bryce, and I would concur with that.
Okay, we'll check with our ag department, and we'll have an answer for that, and we'll get your info on that, Brenda. And it's a good question. We'll get it up on our website as well to share it with the public. Yeah, in case other people want to know that. That's a good question. I should give out the website that we often post updates on. It's michigan.gov/flintwater. Again, www.michigan.gov/flintwater, and we often post updates on there that are relevant to the Flint water crisis and information you might need. Again, press 0 to ask the governor a question. I am going to go. The next question here is Victoria. Go ahead with your question.
Hi, my name is Victoria Weisenbaugh.
Hi, Victoria.
Hi, I'm concerned. I've had 6 grand mal seizures myself, and I've lost 163 pounds. And my girlfriend has had 7 grand mal seizures. I want to know if you're going to replace the pipe, and about the children's health in the future. And I lived at 48507. I just got tested for lead yesterday, and my home was tested where I'm seeing it now for the last 2 months. Prior to that, that's 48503. Prior to that, I was in 48507, 640 Lincoln Avenue, 613 Appleton Avenue, or Appleton Street, excuse me. I drank tap water and I had 6 grand mal seizures. I don't even know about that water over there, but I was concerned about the pipes. I think they need to be pulled up and replaced, not a new chemical added in. You're just adding in another poison into our bodies.
Yeah, I had trouble hearing some of your comments, but with respect to the order to do things, this is where we're relying on Professor Edwards and the outside experts. That one of the things they found, they had similar problems with lead in Washington, D.C., and they found the best way to handle it was to actually recoat the pipes, and the chemicals being used that are doing the recoating are chemicals that have been in the water supply and were in Detroit water for all those years. That people were using. So this is this fairly standard practice on how it's done across the United States, because lead pipes exist in many communities. We need to reestablish that coating, and it can be considered safe to drink out of the tap then. The pipe issue is an important one, and that's something that we want to do based on scientific and engineering advice from the experts. That's why we're going to do the mapping of what the pipe system is, and then decide what's the appropriate order to remove those pipes, and to do it in a way that if it's not done properly, it can actually release more lead into the system than just leaving them there. Again, we want to eventually get into the replacement cycle, but it needs to be done in a fashion that we can assure your safety as the process happens.
Thanks. Again, press 0 to ask a question. Governor Snyder is answering questions this afternoon. Our next question is from Sheila. Sheila, you have a question for Governor Snyder. Go ahead.
Governor Snyder?
Yes.
Oh, this is Sheila. I was wondering why had there not been a mapping of the pipes done prior to the water crisis?
That's a good question, Sheila. It's true in Flint, but also a number of other communities, is they didn't keep good records. This goes back over the last 20, 30, could be 40, 50 years or more. That in many cases what we found is there were simply note cards that had some reference to what kind of pipe might have been put in. And a lot of work was done trying to go back to some of the old contractors, the engineers that had done that work. And so we've tried to recreate that information as well as possible. Ultimately, we've got some records, but now we're going to go through the process of actually confirming what kind of pipes are in the ground. And that will involve actually asking some homeowners to potentially let plumbers come in and look to see what's connected down into their basement. It will involve actually digging up some places to look at what the pipe is. A combination of all those facets will be taking place over the next month.
Thank you, Sheila. Our next question is Cornelius. You have a question for the governor. Go ahead, Cornelius.
Yes, Governor. Hello?
Yes, Cornelius.
Yes, my granddaughter is 3 years old, and over the past 2 years, she'll live with me off and on. And I had her tested, but in Ohio, which is where she lives. And the doctors, they're saying that you couldn't tell if lead was in her system or not. But I know she's been exposed because she stayed in my house. What can be done for her since she's not a resident of Flint, Michigan?
That's a good question, because our focus is really providing services in Flint. So let me consider that question to see what might be possible, and we might want to get more information about how much time she spent in your residence and what kind of blood tests or work she's had done already.
Yeah, Nick, I don't know if you have anything additional about what might be
what I would stress, Cornelius, is you've done the right thing. You've gone to a primary care physician. She's gone to a primary care physician. She's had her blood lead tested today. You've let that primary care physician know that there was a potential exposure in the past, and you should keep that. They should keep that on the forefront of the conversation with the primary care physician so they can continue to monitor where she is at.
Thank you, Nick, and thank you, Cornelius. Press 0 to ask us a question. Governor Snyder is answering questions. A couple pieces of information I want to give out. I gave it out a little earlier on the call, but some ways to get information are the website we have, which is michigan.gov/flintwater, or you can call the United Way 211 number. So you just dial 211 and the United Way if you need supplies or resources in your home delivered to you. Our next question is Monica. Monica, go ahead with your question for the governor.
Hi, Governor Snyder. My question is, I am a caregiver to my mother who's on a trachea and vent, so I do 24-hour care. I don't have transportation, and I also know I have a disabled vet who he looks out for across the street. There are a couple other people on my street who doesn't have cars. I think a good thing would be that when they are bringing water filters and testers and the bottles out, that at one point somebody could actually pick back up the bottles for those of us like me who can't get them back to a certain area or location. Then maybe that will help you be able to map out better this water crisis or somewhat or somehow.
Yeah, I appreciate your question, Monica, because that is, in addition to getting things delivered to people that need it, the recycling is a good question, and we've tried to launch some new efforts to improve recycling, but your point about where people don't have the opportunity to bring them. There is some curbside recycling, but we've even heard feedback that whatever containers are available aren't large enough to hold all the bottles. So we'll try to follow up with you specifically, and we're also trying to work out the whole issue about improving recycling, because we'd like to make sure those bottles get collected appropriately.
Thank you, Monica. Next question is Wilma. Wilma, you have a question for the governor?
Yes. This is Wilma Mitchell. How are you?
Good. How are you, Wilma?
Good. I have two questions. The first question is a really quick one. I did pick up the kit to have my water tested, and I turned that in. But someone was saying that there's somewhere online that you can go to review the results, or is that just going to be mailed back to me?
No, they're supposed to get you the results, but you can go online to see them. And the place to go is. Did you want to give them the address?
Yeah, it should be michigan.gov/Flint water, and the test results are listed there. I don't know if Nick, Bryce, if you have another spot that DEQ posts the testing results.
So this is Bryce, and yes, that is the primary spot where we post them electronically. But in addition to that, we email those results to the county health department and the city also mails a hard copy to the resident. So there's really three different ways that the resident should be receiving those results. But if they're not getting those results for whatever reason, or if she's looking for a result that has been some time, certainly we can follow up on that. If she wants to leave her name, we can figure that out for her.
Okay, and my other question was, I know that there's a lot of money being donated to the city of Flint, and I wanted to know where's the money going and how is it being handled or who's overseeing it?
I appreciate that. There are a lot of people making donations to many different people, but we're trying to focus the resources with the Community Foundation of Greater Flint. And there's a website that we point people to as the main location to go for donations of financial resources or other goods, and that's helpforflint.com, and it's FOR. So it'd be helpforflint.com, and that's the location we're trying to get it in a coordinated fashion. It's one of these cases where we've got many people from all over the country, which is great, that are donating to all kinds of different organizations, from helpforflint.com, which is the community foundation, to different churches, different civic organizations, a lot of different organizations. So we're trying to do this in a focused fashion as much as possible so we can provide the greatest help to all of you.
Thanks. Good questions. We are going to go to our next question. Is Todd, you have a question for the governor, and for anybody else, if you're on the phone, ask a question, press 0 to ask a question. So Todd, go ahead with your question.
Good afternoon. I've got two questions. The first one, I saw, Governor, that you've allocated $25 million in your 2017 budget for lead service line replacement. The first question regarding that is what's available for 2016, because 2017 seems a long way away, and what's the determining factors or metrics for who gets it replaced? And then my second question is what is your plan for relief for homeowners whose home values have been negatively affected by this crisis?
With respect to the $25 million, Todd, we're actually looking to do that in a 16 supplemental to go with the package. So hopefully that money would be available even earlier, and the question is when the legislature approves it. In terms of how it gets prioritized, the priority will be based on this study that we're doing of the infrastructure to help determine where the pipes creating the greatest issues are and to do it in some priority fashion. So I think there will be a very good system to do that. And again, this is why it's important you encourage your legislators to support the budget package so we can get that through. In terms of home values, that is one of the challenges. And one of the things to do there is we want to do a lot of efforts on economic development to strengthen the city of Flint. We've had some success there, but there's much more to be done in terms of bringing more jobs, bringing more companies that want to do business in Flint. The best way is to strengthen the entire economy, which can help bring back home values.
Thanks. Next question is Jackie. You have a question for the governor. Go ahead, Jackie.
Yes. I know we get the filters for the drinking water, and my question is, can we get one for the showers?
Bryce, do you want to cover shower filters and what they what the thinking is on that?
Yeah, and perhaps, this is Bryce, perhaps this is a better question actually for Nick, because this really has to do with the dermal exposure issue. Do you want to answer that one, Nick?
Yes, I can answer that question. Unless lead is very highly concentrated in your water, it is safe to bathe and shower in, so there isn't a need for a filter on a shower. If you have concerns, I would certainly submit the water test that has been provided and check your results, but only in a very few instances across the entire city have we seen lead in high enough contents that would warrant any sort of caution there. And in those cases, the Genesee County Health Department has reached out directly to the homeowner.
Okay, thank you, Nick. There's a phone number I also want to give out if anybody has questions. Again, I gave out the website, michigan.gov/flintwater, but if you have a direct question and you want to call the governor's office, it's 517-335-7858. Again, it's 517-335-7858. If you have a question and you didn't get a chance to ask it today, or you think about it after this call, please dial that number and somebody will get you an answer. Our next question is going to be Raman. Raman, you have a question for Governor Snyder?
Yeah, Raymond Hall. Yeah, how you doing? It's
good. How are you, Raymond?
It's great. It's great to speak with you. Thank you very much for giving me the opportunity, and you're in the community and stuff. I was told to concentrate everything that I'm trying to into one thing. So it's the Kids Initiative for Safe Drinking Water. I wanted to get I'm working with the Flint Community Schools and everything. Brita, the Drink Up campaign with the Michelle Obama. All of it is all combined in this one thing. You're trying to tell me to put it in there. So to ask about the Kids Initiative for Safe Drinking Water and how I can include my group and things that I'm doing into this. Could you speak more on that for me?
Yeah, Raymond, I appreciate that. It sounds like you have some people that want to help. And one of the best ways to do that is the website we mentioned earlier, helpforflint.com. It's a great place that you can provide your contact information so people can follow up with you about how to get you engaged. It's great. You want to help particularly with the kids in the schools. Again, we're going through actually replacing fixtures in the schools now to help deal with some of those issues, but there's still an issue about them being on bottled water and other challenges. So if you want to volunteer or you got people that can help do that, it'd be great to have you involved.
Thanks. Again, if you have a question, press 0 on your phone. We're going to try and get to as many as we can. We got a little time left here, so I'm going to go fast to Kevin. You have a question for Governor Snyder. Go ahead, Kevin.
Yes, Governor. I was wondering, I paid my my water bill since 2014 till now. I'm wondering if I can just pay the sewer and not the water part.
What we'd prefer, and I appreciate you being a good payer, is to continue to pay, and what we're working on is getting the $30 million allocation approved through the state legislature. It's been approved by one chamber, by the Senate already, and hopefully the House will take it up soon. And then what we hope to do is figure out the best way to put a credit on your bill. So you'll get a bill that will show you don't need to pay a significant portion of your bill and how to address the fact that you've been paying, and we want to give you a full credit for the 60% of your water bill, the water portion of your water and sewer bill going back to April of 2014.
Thanks. Our next question is Paul. You have a question for the governor. Go ahead, Paul.
Hi, Governor Snyder. First off, I want to just thank you for taking the time out to talk to us as constituents. But my question to you is, a lot of the efforts have been focused on like giving water to people, and I understand that's important. But what efforts have been made to help with the kids who are going to now be like lifetime disabled, and not only them, but we know that lead poisoning can be passed down through the genes, so this is potentially a 2 to 3 generation problem for kids and their offspring. So what have you guys done any discussions or had any plan sessions on what we're going to do for the long run?
Yeah, we've actually, one of the things, there are things that can be done to help in the short term that can help minimize the impacts longer term. And I'll actually ask Nick Lyon to walk through some of those, because we've got a whole series of programs, some of which are already launching or starting to launch now, particularly around nutrition, but also follow-up monitoring of children and health care through the educational system and through healthcare providers to help address all those kind of concerns.
Hey, this is Nick. The governor is exactly correct. The major thing that we can do right away is know what the blood lead levels are currently and assess any sort of blood lead sources that are in the home. So that's step one. Step along with that is ensuring that you have a diet that's rich in calcium and iron and vitamin C, because that helps mitigate any sort of impacts of lead on the body and actually stops absorption. We are in the process of developing with our primary care providers in Flint, the Greater Flint Health Coalition, the protocols to really start to work with children who may have been impacted. And when there is an impact, we are working with the Genesee Health System to really work on intensive case management. In many cases, we know that through our Great Start programs and our early on programs and with daycare, we can, with some interventions around education, we can mitigate many of the issues that could arise because of lead.
Thanks, Nick. Just again, I'll give out a couple of phone numbers for people who may have joined the call late. If you didn't get a chance to ask a question today, or you think of a question after the call, you can call the governor's office at 517-335-7858. Again, it's 517-335-7858 if you have a question for the governor that you didn't get to ask today, or you think about it another time. And I'll give that number out again before we wrap up the call. But next, I'm going to go to Perry. You have a question for the governor. Go ahead, Perry.
Good evening, Governor, and all your guests. I'm concerned about, have we considered using the new plastic piping to cut down our expenses? And another thing, we're getting quite a few donations into the city, and I think we need to really take a step back and reevaluate. I know everybody's in a hurry to go, but certainly you have a great task on your hand with your team in order to make sure we don't miss any pipes. So have we considered using plastic?
Yeah, I appreciate your question, Perry, and it's good. Are there new things to be done? Actually, I'll ask Bryce from the Department of Environmental Quality to chime in, because yeah, we want to look at pipe replacement, and one of the issues is the best materials to use for long-term success.
So, yes, for service lines, plastic piping or HDPE, heavy-duty polyethylene, are approved materials for that. That's really part of the total engineering analysis, though, that happens when they start replacing lines system-wide. They have to look at soil conditions and a lot of factors. But plastic piping is an option for replacing service lines.
Hello?
Thanks. Go ahead, Perry. Do you have another question?
Yes, I got a part two. Okay, I think we need to really look at this, our situation in the city of Flint. And what I'm concerned about is I've been in a lot of places all over the country looking at after effect. I think we need to be putting some things in place for prevention. When all the lights, the camera, and everybody, I think we need to be putting some things together in the community to keep our community strong, to keep continuing to build, to keep continue coming together. We must start talking about some type of prevention program. What do you think about that?
Well, I appreciate that, Perry. That getting the community to work together on these issues is really important, and I appreciate working with the mayor on these topics. And that goes to the whole question about, how can we deal with this lead issue? We're working the water side of the lead issue a lot. There are still a lot of other aspects to lead you need to be potentially concerned about. And so we'll be working hard to get prevention information out with respect to lead and any of the other conditions that you might run across as we go through this process, because we want to be proactive. It's always better to prevent a problem than to have one. This is just a terrible situation that, again, I apologize to everyone in Flint for this. We want to focus on fixing it, making sure nothing like this ever happens again.
Thank you.
Thanks, Perry. All right, so we're going to go to one more question here. Brandon, you have a question for Governor Snyder? Go ahead, Brandon.
Yes, good afternoon, Governor. My question is, what is your timetable for the additive solution that you're going to put in the water so that it can be safe to drink, and how long do you think it will be before the water is safe to drink? And also, I heard earlier that this issue happened in Washington, D.C. and other areas. How well have that worked for them in terms of them being able to return to safe, healthy drinking water and bathing water?
I appreciate that, Brandon. If you look at in terms of our process to reestablish a safe coating on the pipes based on advice from experts like Professor Edwards, that actually began when we switched back to Detroit water and sewer water back in October. On December 9th, additional additives were put in to supplement the amount that already came in Detroit water and sewer. And the amount that was in Detroit water and sewer is the amount that had been there for all those years before. So we're doing some additional amounts based on recommendations from experts that should be doing the recoating as we speak. We don't want to assume that it's safe, though, until truly extensive testing's been done that has been reviewed by the environmental quality people at the state, the federal level, and third-party experts. And so we're going through that process now, and that testing cycle hopefully will begin in the next few days and will take place over the next couple months. And the Washington, D.C. part of your question is a good one. They had serious issues there that went on for some time, and one of the things they found about how to deal with the question is they actually started digging up pipes too quickly and created more problems than if they would have followed a methodology that says work on recoating, work on testing, work on infrastructure mapping and prioritization, and then work with good engineers on the right process to replace pipes. And that's what we're all collaboratively trying to do in this situation, to learn from those lessons.
Thanks. I'm going to go quickly to try and squeeze one more in here. Tony, you have a question for Governor Snyder. Go ahead, Tony.
How you doing, Governor Snyder? I have a question, and it might be a little bit of a winded one, but to make a very long story short, I own a restaurant in Flint, and I talk to a lot of people every day, and I feel that the people in general are not getting enough education on what they can be doing at home to make themselves safer, like flushing water. You know, I talk to people all the time, and nobody seems to know that flushing water can definitely help, especially since a lot of the problems are coming from inside the home. I feel like our local, if there was something way we could work with our local media to help educate the residents on things that they can do. And another thing that I hear all the time is that they're not paying their bill at all, which is obviously going to cause problems for everyone down the road. So I guess my question is how can we focus with media so that instead of just getting a lot of negative feedback and about who we should blame for the problem, how we can protect ourselves while we are home until the problem is solved?
Yeah, I appreciate your approach, Tony. And again, the things you're saying are really important and actually constructive to help solve the problem. So that's something we're continuing to work on. And as we move through the different phases of this, we can do more and better on communications. And so that's something, if you'd like to help contribute to that, we'll try to make sure we follow up with you and get your ideas and how we can then get the community working with us. Because, again, I think it would work best in terms of getting the media to get on these messages is to have community representation along with the city, the county, and the state, and the federal government all working together to say this is what we would ask you to do in terms of public service announcements and other tools. So thank you for bringing that up.
Yeah, it's a great point. And maybe Nick or Bryce, if you just want to give some specific steps that the people at home who are listening should do regarding filters or flushing their pipes, any advice you have for them?
Well, this is Bryce. And yes,
Go ahead, Bryce.
Flushing is one of the basic treatment technologies that we have known for years is important in providing safe water. And I know particularly Tony, being a restaurant owner, that's one of the techniques that I understand the local health department and others have been talking personally with all the restaurants. But we do need to do a better job getting that message out broadly to the citizens and the residents and of this city, and I think we can do better there. The other thing related to that is so important is the fact that the phosphate treatment that we're using for corrosion control, unless people are using the water and flushing it through their pipes, it's not going to be effective. And so there's another benefit to flushing there.
And the only thing,
Thank you, Bryce.
And the only thing I would add is that with the filters, when they're NSF certified, they will definitely provide safety. So we are recommending filters at this point in time.
Great. Captain Kalinsky, who's running our emergency operation, any hints or advice for people in Flint before we wrap up the call?
Just to continue to support your neighbors and one another, and if there's anyone that you know of that is homebound or needs assistance, to please let us know. Call 211, and we will continue with our rapid response teams to assist with the mission of getting everyone filters and water in a timely manner.
Great, thank you. I'm going to let the governor wrap things up, but before I do, I want to give out the phone number in case you had a question and you didn't have time to ask it today. The phone number to call is 517-335-7858. Again, I'll give that one more time, 517-335-7858. If we didn't have a chance to get to your question today, and I'm going to let the governor give some closing remarks here.
Well, thank you for being on the call, and thank you for your questions. Hopefully we were able to provide a number of answers, and we learn something from every time we do these calls so that we learn new questions that people have that we can follow up on, such as growing food, looking at the question of non-resident children, how to do better communication. So you're hopefully helping all of us get better by asking these kind of questions and having this dialogue. We are absolutely focused in on helping you address the challenges you face, and it's terrible that you have to deal with bottled water and filters. So we're going to work hard to make sure you have access to those, particularly if you can't get out and get them. That's why we have the United Way 211, and we want to follow up with that. And if you have any issues with that, please let my office know. We're going to continue to work hard to get the water coming safely out of the tap again, and then look at the longer-term issues about pipe replacement. And then particularly the follow-up care with the children in terms of nutritional programs, educational and healthcare programs to support them for a number of years to make sure that by acting now we can minimize the long-term consequences as much as possible. And that's the commitment I've made, and we're working hard to deliver to you. So thank you for taking the time to be on this call.
Thank you, everyone. Again, one more time, I'm going to give out that phone number. If you didn't get a chance to ask a question today, it's 517-335-7858. That's 517-335-7858. We really appreciate all the questions and you listening to the call today. Thanks, and have a good rest of your day. Bye-bye.